the remote meeting of the Human Services Finance and Reform Committee, sponsored by the Red River Valley Soybean Growers, Sugar Beet Growers Association. And if they come to visit, you get this cool pen with the floating sugar beet. So we're trying to, broaden our outreach to all parts of the state. So I want to welcome them as our sponsor today. We have a considerable amount of work. We're going to be moving on the COVID Emergency Human Services Finance Bill and move that out today. We're also going to talk about some very significant issues with group homes and the likes as to how they're being served and with the ombudsman. And we have some testifiers, and they won't have to talk quite as fast as they did last time. And I apologize for that whistle stop through. And so we're going to try to get done at 4:30 at any rate. And I do have my staff keeping an eye out for hands, but if you want to ask something, just kind of do what we've done in the past and unmute yourself and call attention that you want to talk, and that might work just as well. If it kind of bunches up, then we'll go with having my staff help me out. So anyway, with that, let's take up Senate File 3694, and I will move the A7 amendment to get it in front of us. And then we'll take testimony. I do want to have one oral amendment just to take out a section that doesn't make sense yet. And so I'd like to offer just an oral amendment to delete lines 10.30, 10.31, and 10.32. That has to do with collective bargaining, and it's it's not necessary, as I understand. It just makes things much more complicated. So I'll incorporate that. And so any questions from anybody before we start? Welcome aboard. So let's start off with Jean Calvert. And I'm going to ask you if you can keep it to 2 minutes. And if you could focus on the bill that's before us. We've had a lot of testimony from most of the groups represented today about the challenges they face, and we know that they're dire. And this bill is an effort to address that. And so if you could talk about the bill, how it might help you, that would be good to hear. Or, and we know we're kind of proud of a lot of it, frankly. And just to remind people, there's 4 parts to this bill. And I should comment that we've actually changed the retainer payments to a grant. And so that the different groups who felt they needed some help keeping their fixed costs would then apply to DHS through a process. The challenge was, how do we not become first in line with the federal money? We want the federal money to come first and we'll come after. And so by having a grant, you won't know how much you're going to get or if you're getting any. And I hope you all get what you need if we can get this passed. But that way it solves that particular matter. The second element is TEFRA. And so this gives a TEFRA holiday to somebody who's lost, I think, more than 10% of their income during this time. It doesn't address arrearages or any of that. And then when the time period expires, then they'll recalculate your TEFRA payment. With the NEMT providers, we increase the rates across the board 50% and make them eligible for the grant program for their fixed costs, because we want to keep people open. And then Senator Ralph has been working very hard on the PCA and the DWRS providers increase of 15%, and we'll talk about that more a little bit. So that's the highlights of the 4 elements in the bill. And so now Ms. Calvert, if you want to take it away, that'd be awesome. Welcome.
Okay, thank you. My name is Jean Calvert. I'm the Executive Director and founder of Interact Center for the Visual and Performing Arts. We're an adult day program serving 110 artists. We've been with a wide range of disabilities who've been in business for 24 years and have served thousands of artists and artist clients. We call them artists, but they're our clients. Historically, Interact received 70% of operating budget from providing services and billing for the client's waiver. And we've always had to raise 30% through donations and grants. This year, with the because of the unbanding, we're seeing a 30% rate deduction. So it's been a big financial blow to Interact. On March 18th, we closed our center due to COVID-19, and we've been unable to bill for 26 days counting. Despite that, our staff kept doing remote services, checking in with our clients every day, mailing them art supplies, Most of our clients, many of our clients live in semi-independently. They don't have any other services. So these video and call check-ins were a lifeline for most of these artists who struggle with mental illness. However, we have not been allowed to bill for reimbursement for any of these vital services. So this Monday, we had to furlough 16 of our direct care staff when we were notified that the PPP and the SBA loans had run out. So the bill you're proposing may be our only option. However, we still need to bring additional funding in from grants and donations, as we always have, even in the best of times. So I wanted to know if this grant, it seems if we continue fundraising and asking for donations, we would be forced to pay back any money. Is that the case? And then one other thing, the 10% increase in our daily rate for staffing cost is very welcome. However, if we do not have money for operating costs, it would be of no benefit because we would have to close our doors. So I'm sure many other people are in this dilemma, but I wanted to ask if, yes.
Okay, well, thanks. And that was very good. I appreciate you being concise. For people's math at home, that was 2 minutes and 30 seconds. So, but I appreciate, I mean, these grave problems, you got 2 minutes, and I hate that part. The idea of the grant is that the commissioner would decide what things are carved in and carved out. This is definitely kind of a raw product. And hopefully this will move through the system, and there'll be some chances to dialogue about how to get rid of some of the rough edges. And just advice to you, and then we'll move on to our next testifier, Mr. Nichols, is have you talked to the department about ways to be paid for your alternate sites? It seems like they have a whole array of ideas about that, and we can take that offline. But anyway, so
we have, and so far we have not been able to.
Okay.
Bill, yes.
Well, DHS, get it done, will you? Okay, I know that they're trying very hard, and we're going to talk about a lot of those accommodations next week because we're going to have a hearing about that. So
thank
anyway,
you.
Mr. Nichols, welcome back. Thanks, Ms. Calvert. Appreciate you. Mr. Nichols, we've heard from you a couple times. Welcome back wherever you are on my screen.
Yes, here. Thank you again. Unfortunately, unable to connect video on a bad cell connection, but I appreciate the opportunity. CEO of MAC. I think I'll try and set a record of being even under that 1 minute mark. All I can say is thanks a ton for the efforts on this bill. The retainer payments or grants definitely will assist MAC. We have lost an immediate 1.1 million in those handful of days where we were shut down completely. We pivoted quickly. We've ramped back up telehealth and in-home services, but we're at about 10 to 20% of the scale we were previously. And so the support for some of those fixed costs immensely appreciated. And we are still losing money at the level that we are, but we're trying to do everything we can on our side to generate revenue and, frankly, more importantly, support the 500 kids and families that we do. So with that, just appreciate the support. And as it stands, it definitely would benefit MAC and our mission. Thank you.
Well, thanks. And I just I appreciate you, Mr. Nichols, we really appreciate what you're trying to do. And you're kind of the archetype of sites that are heavily Medicaid dependent. And so you're speaking for a lot of providers. So I hope you felt the weight on your shoulders. And just to encourage people as they're listening, this bill is by no means a done deal. There's no global agreement. This is a product of the Senate pushing the industry, pushing the system to try to help have a system open when we're done. So if you're watching at home, please get a hold of the governor and the House leaders and the Senate leaders and whoever else. So next we have Rob Woodlick, and welcome to the committee.
Hi, thank you, Chair Abler and committee members for having me again. So I'm part of MMCCD and GUSU and a quadriplegic. Last week, I kind of touched a little bit about how I've struggled with my home care. One of my home care agencies shut down because they were concerned with liability issues. And so I've had issues. Luckily, I live with family members, but it's not easy. And then we have concerns about the quantity of people coming into our house too. So to fill it up with 10 different people versus 2 or 3 makes a huge difference. That said, the revisions that you made in the amendments, the pay increase is huge. That will help us recruit more. The effects, providing funds for PPE out of that pay increase too, that's definitely going to make things safer for both sides. And increasing the hours limit is one of the smartest things I think you can do too. These are all basic, quick fixes. We know that these are the most effective things that are probably we can do to fix this. It's not perfect. 15% pay increase at a maximum is going to bring the rate up to $14.95. So it still doesn't meet Minneapolis's minimum wage standard. Doesn't meet Amazon's payroll, but it's a fix. It's better than it is, and it's well needed. It will help me. It will help a lot of more people than me. So thank you.
Well, Mr. Wedlick, I really appreciate you testifying, and we're doing what we can. And so this is a start, and maybe you can, you can even go further, but we're trying the best we can. So I appreciate that. And just I keep thinking of little details. So we're working off the A7. The A2 is last time's bill. So if people wanted to compare their section with the new section, that was why we put that there. And the A3, I did not believe will be offered because it's rendered moot by the grant program. Yeah. So Ms. Ansem, welcome.
Hi, thank you for the opportunity to support the increase for PCAs. I am a 39-year-old with spinal muscular atrophy and respiratory failure, and I live independently in an apartment in Minneapolis with 24 hours a day PCA services to meet my health, safety, and well-being needs. My PCAs have always played a vital role in my life, but with COVID, their importance has increased tenfold, and they are risking their health to come to work to enable me to live. Getting sick with COVID would kill me. Because of this, my PCAs have to do my errands in addition to my personal cares, further putting them at risk for COVID. If they are knowingly exposed or develop symptoms, I absolutely cannot have them come to work. This is a problem because PCAs do not earn sick pay. It is vital that the bill be changed to include the language to provide PCAs with the benefit of sick pay. And while a PCA is unable to work, my other PCAs are expected to pick up additional shifts, and this can be naval work overtime. The state currently does not reimburse for overtime, so if they do work it, they do so unpaid. And if I can't have my PCAs work overtime, I can't meet my health and safety needs. So it is vital that the bill be changed to include the language that provides PCAs with the benefit of overtime pay that is reimbursed by the state to preserve the care needs of clients and pay PCAs for their hard extra efforts. It is also imperative that PCAs have access to PPE to protect both themselves and their clients. With PCAs having increased exposure to COVID during the essential work that they do, providing funding and access for is the right and responsible thing for the state to do. And it is crucial that the bill also include language to include this. PCAs have been working with increased exposure risks for many weeks now as Tier 1 workers. Therefore, the bill must include the language to retroactively pay PCAs the rate difference back to March 13th when this all really became a problem. This is a scary and uncertain time in my life, and if things don't change, by June 1st, I will be down to 1 PCA for 24 hours of care because of COVID and the measures that my PCAs have to take to protect me. I know there are numerous others in the same situation. It is time to give the PCAs the respect they deserve, an incentive to want to continue working under such conditions, and to attract people to a field where they will be an essential frontline worker during this pandemic. Thank you for
Thank
your
you.
time and your consideration.
Oh, yeah, and it's been eloquent, and so we're trying, and I would suggest that this is what we're gonna do for today, the best we can have right now, trying to even get this moving along. But as it moves, I suggest you and your, contemporaries are stay engaged in the process and try to make it as good as it can be. So God
Of
bless
course.
you. Thank you.
Thank you.
Adrian Kleinman, hello. Oh, there you are.
Hi, can you hear me?
I can hear you.
All right, great. I'm going to be echoing a lot of what some people have already said, but I'm going to, say it anyway. So my name is Adrian Kleinman. I'm a recipient of PCA Choice Services. It's no secret that the home healthcare industry has had its flaws and struggles, and I found that the pandemic has revealed them to be even more dire than before. I've been on the verge of a panic these last several weeks since the cases of coronavirus have skyrocketed in the United States. I've been participating in social distancing just like everyone else, but I'm unable to fully isolate. I still need my staff to come to work and care for me because, funnily enough, a pandemic does not equate to my disability being non-relevant. This fact alone brings me into a risky territory where my protection is the trust I have that others are practicing state orders to stay at home. I lost my spot, sorry. And up the ante on their cleanliness and safety when not with me. Not only do I fear that I'm going to contract the virus, but I fear that those who leave their homes to help me live independently in my own will contract it as well. And if this happens, I can't afford to be exposed to them for the risk of catching the virus. But with there being no sick pay, I worry that many of my assistants won't be able to take the time off work to get healthy again out of fear of not making their rent. It's essential that there be funds provided so that my assistants can safely isolate and get well again while receiving funds to support them. If they have no protection, they may choose not to return to work for me and will likely be put in an unsafe position. I fully support there being a 15% rate increase for those working for me during the state of emergency. In addition, the monthly cap on hours worked being increased to 310 will allow those filling in gaps of care coverage to be compensated rather than being forced to work for free. If there's no incentive for people to want to fill these positions of care that myself and millions of others rely on for our autonomy, I fear that I'll be left behind once again, stranded and abandoned during a worldwide crisis. Please do the right thing and compensate these wonderful humans who see the value in the work that they do. And please do it not just for them, but for millions of individuals like myself that are exhausted from feeling like we are disposable and unworthy of being treated like a full human. Thank you.
Well, in this climate, just none of us think that you're anything like what that is. We are here trying to do our best, and we have just so much, hope and support and anyway. So thank you for coming forward. I really appreciate that. And the same as Ms. Onsom, I suggest you keep engaged in this along the way, trying to actually have a bill pass, and then work with whoever else is going to help along with this to enhance it the way you might think. So, Ms. Peterson, welcome.
Hi, thank you for having me. Mr. Chair and members, my name is Shelley Peterson. Thank you for the opportunity to testify in support of the A7 amendment for Senate File 3694 today, and for including the proposal to waive parental fees during the peacetime state of emergency in this bill. My husband and I live in Moorhead with our 3 children. Our youngest son, Owen, is 8 years old. He's a very social kiddo who loves to play at the park, go swimming, especially go shopping at Target and Scheels. Owen has Down syndrome, and he was also born with an immune deficiency disorder, which has resulted in many trips to the hospital over the course of his young life. Owen recently got a DD waiver, and we used the CDCS option, which has offered us much needed support and respite. However, this comes at a huge cost for our family of nearly $700 each month, over $8,000 per year for parental fees. These fees have placed a huge financial burden on our family, which hit especially hard when COVID-19 outbreak reached Minnesota. As a nurse of 22 years, I have devoted to my career and absolutely love what I do. But because of Owen's underlying health conditions, I recently had to quit my job. I just could not take the risk of exposing myself nor my family, especially Owen, to this virus as a result as the results could be devastating for him. In losing my nursing salary, our family is now dependent upon my husband's income, and his hours working for the railroad have also been reduced. We've considered applying for a reduced parental fee, but the process is very consuming and very confusing. I've heard from other families who have just given up because no one is responding to their emails and questions about the process. So now we are paying a significant parental fee on a drastically reduced income, but can't even access the sports which the fee is supposed to afford us. We can't get staff support in our home because, again, we just can't take the risk of exposing Owen to this virus. So the question is, what are we paying for, and how can the legislator make sure that parents of children with disabilities don't fall into even deeper crisis during this pandemic? My family is not alone in these struggles, as you'll see in stories that were included with the written testimony from the ARC of Minnesota. On behalf of everyone facing these challenges right now, please support the proposal to waive parental fees during the peacetime state of emergency. It is vitally important to families across the state, just like mine.
Well, and thank you. And actually, and just so all the testifiers know, the department staff are watching somewhere. And so you're getting right into their ear. The commissioner is coming later on, and I know she's deeply engaged in this. So we're trying. So thanks, Ms. Peterson.
Thank you.
God bless your family.
Thank you.
Ms. Housey, is that what I said, right?
Yes.
Welcome.
Thank you so
Welcome
much.
back. And I'm so sorry I had to rush you off last time. This is my penance. So you get a whole fresh 2 minutes. So welcome back.
Well, okay, you give me a second chance. Thank you so much. Hello, and thank you for the opportunity to speak today. My name is Deborah Housey. I am a home care worker testifying on behalf of my union, SEIU, Healthcare Minnesota. I appreciate the bipartisan support for a PCA rate increase. I work every day as a home care worker, caring for 3 different clients. I am worried for both my health and my clients' health during this pandemic. One of my clients is 100-year-old, and the others have compromised immune systems. Home care workers keep the most vulnerable in their community, not in hospitals or nursing homes. A wage increase could really take some stress off the shoulders of workers like me, who are on the front lines of making sure our most vulnerable are safe in their homes. I am taking extra trips to the grocery store, to the pharmacy for my clients. It might mean less stress about filling the gas tank, or being able to buy an extra gallon of milk or a loaf of bread for myself and my families. We all know food has gone up. It's vital that PCAs and family caregivers get this wage increase, PPE, and sick time right now, or the care crisis is only going to get more critical. We all know that a rat snuck in on our healthcare system, and now it's all up to the frontline workers to keep everybody safe, like myself. Thank you all, senators and chair, for listening to me.
Well, Ms. Housey, I think after hearing some of the testimonies so far, you're probably their hero of the day. So keep it up. And I told Mr. Nichols he's representing a lot of providers. You're representing tens of thousands of people. So you had a big job, and I think you just kind of knocked it out of the park. So
well,
thanks for coming back and for bearing with us.
So much.
So Ms. Bang, welcome. And we heard from you last time a little bit. So welcome back for your 2 minutes.
Thanks, Chair and committee members. I know I tried to talk really fast last time, but it didn't quite work. So I appreciate the chance to come back today and talk. Yeah. So my name is Peng Bang, and I'm a PCA agency owner, and I'm also on the board of the Minnesota First Provider Alliance. The Minnesota First Provider Alliance is an association made up of about 200 providers in the state of Minnesota. So providers have been trying to find different ways to make sure that clients continue to receive care and not end up in the hospital and the nursing homes. We've been asking existing caregivers to pick up additional clients and additional work hours. The bill to temporarily increase the PCA reimbursement rate would allow providers the ability to pay for overtime. As we've heard some of the testimony, we are asking existing caregivers to fill in gap hours and to take on additional clients. Also lifting the amendment to lift the cap on PCA hours from 275 to 310 would allow existing PCAs to, again, fill in for other workers and to take on additional clients. We know this bill is extremely important, and we really appreciate the chance to support it.
Well, thanks. And that was a minute 12, just so, isn't that nice when you're relaxed? And so anyway, so I think at this point, thank you testifiers, and we could hear from many more of you, but I think you've been a good representative sample. So now if Mr. Monahan and Hauswald like to walk through the differences in the A7, that would be, I think, a good time for that. And then we'll take comments and questions from members, and then we'll move to a vote at some point here. So welcome, Mr. Monahan and Hauswald. You can just trade off like you always do.
Mr. Chair, members, so just to clarify, Mr. Chair, you'd like the differences between the A2 and the A7, is that correct?
Well, just kind of walk through the bill like you do. And so people kind of heard what it was last time. They've all had a chance to read it thoroughly, I'm sure. And so there's some highlights you want to point out in particular. So you can do your customary, high level good work. So thanks.
Okay. Mr. Chair, members, Section 1 is just the language from the underlying bill. It's a technical correction of a drafting error from last session. So Section 2 begins the substantive COVID-related provisions. Section 2 is the temporary suspension of the collection of TEFRA fees during the peacetime emergency. And then it requires the department to redetermine the parental contributions after the emergency if the household income has decreased by more than 10%, and that's an existing standard that's used. Section 3 is new language since the last version of the amendment. This is the provision that raises the limit on hours a PCA may bill from 275 hours per month to 310 hours per month. Section 4 is virtually identical to the prior version of the NEMT temporary rate increase. It still provides a 50% rate increase. What has changed is we removed the exclusion of taxi cabs. So taxi cabs providing unassisted transport would be eligible for the 50% rate increase. There's also language in here about how managed care plans will need to deal with the rate. We've gone with what's called a directed payment. We're requiring the managed care plans to essentially pass through the rate increase to the providers who are paid through managed care. Section 5 represents the biggest changes from the last version. Rather than going with the retainer payments, we've changed the language to a retention grant. Chair Abler mentioned the primary reason for doing this. It was to make sure that providers who may be eligible for a new round of small business loans wouldn't be deemed ineligible because they had a guaranteed source of additional revenue through the retainer payments. By going to a grant program, the hope is that they won't be determined ineligible for future loans from the federal government. Many of the provisions remain the same as far as the repayment provisions, although we did change it to state that the repayment, if any, only has to come out of the forgivable portions of any loans that the provider might get from the federal government or other sources. Some language was added to specify that the purpose of the grants is to cover the fixed costs. Many of these providers, though not all, will be eligible for some of the increased payment rates for the services they are able to provide. that appear in other parts of the bill. Then section 6 is the PCA rate increase. Again, much of this language is the same. There was quite a bit of technical assistance from the department, particularly with respect to how to use or how to direct managed care plans to deal with the rate increase. And section 8, again, received the same sort of technical assistance from the department about managed care plans. I will note the biggest change in this section is a change to the percentage of the rate increase. It was reduced from 15 to 10%. And the reason that was done was that the underlying rates under DWRS are different than the underlying rate under the PCA program. And the effect of this change or this reduction from 15 to 10% is to essentially align the two increases so that the revenue available for the wage increases is roughly the same under the two provisions. And that concludes the amendments, Mr. Chair. I believe you're still muted, Mr. Chair.
Thanks. That's, for some people, that's my favorite committee posture. But so the 10% you mentioned on the DWRS rates still allows an effective 15%. So we can still discuss that the workers are getting in the range of a 15%. Is that fair to say?
We were shooting for a dollar value. So
okay.
The PCA rate increase,
about $2, right?
Was about $2. So
okay.
We backed into what would a $2 increase be for under DWRS.
I get it.
And
okay.
It's on average about 10%.
Okay. So anyway, this is so $2. That's what we're talking about today. Any questions for Mr. Monahan from anybody? Okay. And Senator Hoffman, you had done some research. Looks like you're out in the country Glen there or someplace. You had done some research on the retention grants or retention monies being given some federal approvals. And there's a handout that you provided. Do you want to talk about that a little bit?
Yeah, Mr. Chair, thank you. And members, there's a couple of handouts that were added, one from the state of Illinois and the other one from the state of Washington. And ideally, the state of Washington just recently, as of April 21st, received a letter from the Department of Health and Human Services, Centers for Medicaid Services, allowing them to do what we've been trying to do for the last month, Chair Abeler. And I just gave a link to the actual letter to folks that came from Centers for Medicaid Services to the state of Washington and highlighted about everything from being statewide to HCBS rates, long-term care rates, both under the 1915 K expenditures, which is federal, and then also the 1115A, which are the services and provisions there. And so if you look at that, you'll find that they included within that language, Mr. Chair and members, non-emergency medical transportation, as well as all those service providers that we're trying to address in this bill, and as well within what we did with Senate File 4200. So I share that with you to note that it's being done in other states on the retainer side, which they even mentioned in the Centers for Medicaid Services language, Chair Abeler and members, that they use the word retainer, and they're trying to keep the organizations afloat. So they're throwing a lifeline out, and it's what we've been asking here in the state of Minnesota, and this is one way of doing it with our bill. So thank you, members. I stand for questions.
And just to point out to people listening, earlier in our discussions in our teletown hall, we talked about fixed costs. And the word retention seems to be a much better term, and it's caught on apparently. And so trying to retain a program after the dust settles on this COVID stuff. I didn't prepare the department to answer these questions, but I know the commissioner is coming up later, but is there somebody from the department who'd like to comment on this federal approval of the retention idea? And if not, we'll wait for the commissioner. But well, there you are. Hi.
Hi, Mr. Chair. I'm Elise Bailey, Fiscal Policy Director at the department. Thanks for asking the question. We're certainly assessing it, day by day, as far as what the CMS has been approving. So we'll be assessing that, and as we put a cost to this bill, we'll certainly be taking that into consideration.
Well, and I'm pretty excited, Ms. Bailey and others. In our discussions, even just as recently as 2.5 weeks ago or so, CMS was like, no, we're not paying people to do nothing. And now they're talking about retention. I think this is really exciting. And this bill is, for the lack of a better phrase, a work in progress, but at least it's taking 4 ideas out that I think are critically important to the survival of the system. So thanks, Ms. Bailey. We'll be talking to you some more.
Thanks.
Questions from members on any part of the bill? Senator Hoffman.
Thank you, Mr. Chair, and thank you, Ms. Bailey, for looking at that. There is absolute provisions in there, and I shared the language with Matt Burdick, and also asked him to share it with the commissioner. But you'll see in that link that I provided to everybody, the template is already there regarding what a state did in order to get those provisions passed. So, and if you need any support in that, please get a hold of my office.
Alrighty. Any other questions from members? Senator Hayden, you're down there in Alabama again. You just get around. I know the air flights are so cheap these days. You can afford to commute.
Yeah. It's like, like, I don't know, $10 or something to get down there. But, hey,
yes,
I just wanted to just get a sense from a process perspective. It sounds like you said we were going to vote this amendment out, and I just wanted to get a sense of what that looks like and where it was going from here.
Well, that's a great question. I hope at some point it goes into law. At this point, the bill is pointing out the needs to the system. It's actually going to rules because we're late. The bill we voted out last week is in rules. It's being taken up tomorrow to get it out of rules into the floor. On that bill, just since we're on processes, negotiations are underway with the House, and I imagine you might be interested in some of those discussions. But this is going to go to finance, and this hopefully this bill is a big exclamation point to the problems that we're talking about, and I think the testimony today is compelling. If someone wanted to listen to one 20-minute segment, they could get a snapshot of the pair our friends are in. And so it's going to go to finance and rest there. Fiscal notes get worked out better. New ideas will come forward. We'll see if it can be matched. And I just pray it gets on one of those lists that the governor puts out, or to get us to get this going. And that's the future of this. And I think the more people weigh in, the better. So that's all.
So, Mr. Chair, I think they're great ideas. It sounds like things are being worked out. Is part of the negotiations, like where we had a good, I sit on finance, had a good conversation today about the various COVID funds and federal funds and the general fund. So is that kind of the background negotiations that you're having with the House? I haven't been involved and been more than happy to, but I was just trying to get a sense of if we're looking at this as kind of a COVID fund bill, or is this going to be part of the reimbursement at the federal level, or do we think that there'll be the general fund or some mixture of the three?
I'll just tell you, yes. I don't know. That's all part of a dialogue. And
okay.
We're presenting the need, and we're giving some framework of language and a framework of 4 ideas. And actually, the more you can chat it up at the finance committee, the better. So appreciate that.
Yeah, no problem, Mr. Chair. Well,
Senator Benson will have our eyes and ears. Go ahead. Sorry.
Well, I'm sure she will, Mr. Chair. And just let me know if you need some assistance. I'd be more than glad to help.
I need assistance. Okay.
Okay.
Anybody else? No other questions, because it's my intention then to move to adopt the amendment and then eventually to move the bill out. So before I'll renew my motion that we adopt the A7 as amended, any questions to that? You do speak up. Okay, so then we're gonna do the high sign and voice as well. So all in favor of the A7 as amended, say aye.
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 All opposed? Okay, so there, banged my water glass. That's adopted. And now we're on the Senate File 30, was it 3694 as amended. Any comments about that from anybody? Commissioner Harpsted, did you want to, why don't you, I see you just popped in. Why don't you take a moment and chat about this? That would be, I think, a really powerful close to the dialogue. So welcome to the committee.
Unmute. How's that?
Perfect. Yes, go ahead.
You can hear me?
Yes.
Okay.
Isn't this crazy?
Yes.
We're
Someone
talking
turned
into
on
box.
my cell phone too. Anyway, sorry, you were just talking about.
We're on, so you just popped in. So we have now have the A7 in front of us, which has the 4 elements of the NEMT rate increase, the PCA rate increase, the grant program. By the way, we took almost all your suggestions, so I'm really hoping the enthusiasm that will come from your department about this will even be greater. And then the other one was the TEFRA relief. So the 4 elements are there in much better shape than they were last week.
Okay, good.
So your thoughts just in general, maybe on the 4 themes, and the mechanics are probably less important at this point.
Well, I wanted to just give you an update on the kinds of decisions that we've been making under the executive order.
Well, could you comment about this bill first, and then we'll take up that part later, because we want to. I'll bring you back and we can talk about that a little bit.
I'm sorry, I wasn't prepared to talk about a bill.
Okay, well, that's fine. Well, so we were just on this topic. So let's get the bill out of the way.
Okay.
And then, because I will be interested in your thoughts on it, and I know that you've been kept somewhat apprised. So I didn't mean to set you up for that. I just thought you were here, and I have a lot of spontaneous opinions, and so yours are considered, and I respect that. So Senator Ralph.
Thank you, Mr. Chair. I just want to thank everybody that's worked on this, including your staff, to try and get it put together in the shape that it's in. We've included some stuff that came from several different sources. The raising the PCA hourly cap is something that I think is very important and would provide almost instantaneous relief in terms of being able to bring people that are already online into more homes and more places where they can work. And so that in itself would have an automatic, almost instantaneous effect. So just my hope that we can make some of this or all of this work in one shape, form, or of another. I keep hearing from my people in my district and area who are trying to provide services to the disabled, and it's a tough situation for them. And so anything we can do to help them or to alleviate some of this stress or the shortages that we're facing is all to the good. So thank everyone for doing the work they're doing, and let's hopefully move this through.
And Senator Benson, are you unmuted, or are you just, did you want to say anything?
I apologize. That was from the vote.
Oh, okay. All right. So if there's no more discussion to this, I'll renew my motion that Senate File 3694 is amended, be recommended to pass, and be referred to the Committee on Finance via rules. Everybody understand that? All in favor, say aye.
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 Opposed? I don't hear any. So with that, the bill is, the motion prevails on how the bill is re-referred. And so, Commissioner, I think we'll take up your discussion about the improvements at the end of the discussion in the next section. And just so you know, we kind of modified our plans. I think next week we're going to have the entire discussion. We don't know, we're meeting next week. One of the points would be to discuss all the executive things you've done to kind of look at it and how they're helping out. So you're going to be speaking in the next segment. And so maybe after we finish that discussion, you can come back after Mr. Griffin and fill out the time with the things you've done. Is that all right with you?
Yep.
Okay, perfect. So I'm excited about the opportunities here, and Commissioner, your staff will update you on the contents of this bill. And it's our sincere hope that this will get some traction and help keep some of these people in harm's way in shape and keep the workers there. And I know that's on your mind too. So anyway, so we now have a changing gears entirely. Commissioner or Ombudsman Opheim is here. She submitted a letter 10 days ago or so about, maybe a little longer, about some real concerns about what's going on in some of the corporate housing and so on. And so, Ms. Opheim, I'll turn it over to you to tell us your concerns. I know the department has addressed some of these concerns. And so whatever a composite discussion you want to start there, and we now have a good amount of time. So thank you.
All right, thank you, Senator Abeler and members of the committee. I appreciate being asked to comment on the situation that is facing the state of Minnesota. I don't know if I introduced myself, but I'm Roberta Opheim, the Ombudsman for Mental Health and Developmental Disabilities. And we're an agency that's charged with promoting the highest attainable standards of treatment, competency, efficiency, and justice for people who have been receiving services for mental illness, mental health, developmental disabilities, chemical dependency, children who have emotional disturbance, and others who might fall under the services. Our program is about real stories of real people and how this is affecting them. Again, it may not be that the question they ask is right or wrong, or that anyone has done anything wrong. It's simply that they're confused, they don't know the answers. And so hopefully we can bring some clarity. I think the request was related to the letter that we sent to Senator Gazelka and the COVID working group. And the primary concern raised in that letter had to do with the confusion that's out there, the unanswered questions that both providers and clients had, and that unanswered questions leading to extremely disparate approaches to how people were being served with in those programs. I assume that you all have the letter, even though I must have double pasted something into it at some point, but that outlines it. So I won't go through that unless you have questions on it. But since our comments on April 5th, DHS has reached out to our agency, and we have been working with DHS, with stakeholders, with other advocates, with provider groups to working to put together guidance for how a particular facility might operate. Some of these are just based on existing laws and rules that have not been waived, and some of them are based on some common sense approaches to what would be fair and equitable treatment for individuals with disabilities. This has been a productive process, and there are a few areas that we still need to tweak. So I'm hoping that will come out soon and that we'll be able to provide guidance. This, however, relates to 245D providers and waivered services. And I have some concern that there are other services not included in this particular guidance that might benefit from this guidance or similar guidance for their particular areas. We recognize that DHS and everyone is working hard to address all the variables that the citizens of Minnesota are facing during this extremely stressful time. It's, and that accrues to not just the people being served, but to the providers, to the legislatures, to the governor, to the executive branch of government. Everyone wants to get it right. I think that citizens of Minnesota who rely upon other people for their fundamental or essential services have and retain the exact same rights that you and I retain to the best of their ability. The positive support rule that has been guiding us over the last several years is needed now more than ever. Because when people are confused, when they don't understand, there's more chance for disagreement, for arguments, for inappropriate behaviors that create problems. And so, you know, it really is important. The option should be the same for clients and residents with disabilities as it is for us. Can I go out and take a walk? I can. Can I go to the store and pick up a snack or my groceries? Can I visit with people with social distancing, like talking to the client standing maybe on a balcony or on a front porch, and family members who may want to see them standing on the sidewalk, well more than any of the distancing requirements. Those are the things that we can still do. I can go for a ride. I can go look at the St. Croix Valley, which I love, and enjoy its beauty. We have to have the recognition that those things are available to clients that are receiving services. And some of this has to be a little bit of case-by-case judgment, but with strong guidance, I think people will get to the common sense approach. We have had many examples of concerns that have been raised. And again, I don't really want to comment per se on if someone was right or wrong, or if this is abuse or neglect. That's not what we're talking about. What we're talking about is ensuring that clients, through whatever mechanisms they learn, have the same understanding as you and I might have related to what we can do, what we can't do, what our freedoms of movement are. And so I'd like to just list a few of these. And again, it's not to, it just shows you the level of confusion that's out there. And I'm not going to read through all the ones we've gotten, but we've had lots of concerns about the lack of ability to visit loved ones. We've had concerns with increased behavior from a client due to COVID restrictions, and then maybe needing to give them more medication to calm down the behaviors, more PRNs, to prevent self-injurious behavior. Clients being told that they have to move from an adult foster care to their family home because all other residents did, and staffing now an issue in the home where the one client was left. Callers, concerned clients have been dumped at the ER for behavior, and then the provider refused to readmit due to the COVID restrictions. Client lost a job due to COVID, then lost their housing and income, and so now is afraid that the special review board approval, where he has to sign where he lives, will put him in violation of the conditions of his supported plan for discharge. Let's see, an adult foster care refusing to take client back from the hospital unless the hospital has done the 14-day quarantine periods, even though the person may be ready to leave the hospital by all medical standards. We had a case where the ILS services that were going into an individual's home were suspended due to COVID, and when eventually a welfare check was done, the client had died. There are concerns about in-home services not getting started, COVID restrictions complicating discharge plan from a CBHH due to limits on face-to-face contact and the need for in-home supports to be successfully discharged. Providers not taking new referrals due to COVID-19. Medical professionals concerned about a client's significant mental health symptoms, putting the client at risk for health concerns. Client discharged to the street from an IRTS facility because it was suspected that the client might have COVID. So they weren't quarantined, they were just basically discharged to the street. Client unable to use telehealth for needed services and no other option was available due to the COVID restrictions. Law enforcement limiting transportation services to hospitals due to COVID. Landlords not allowing service providers into the building. Patient psychiatric services diminished due to COVID. Clients placed on back-to-back 72-hour holds because they were on a medical floor instead of a behavioral floor in a hospital, and the medical floor staff was not familiar with the Commitment Act. IRTS facilities wanting to terminate client immediately for not following the stay-at-home orders, even though we all are allowed to go for a walk. One client passed away in his home. There's no direction to COVID per se, but the client had been noting to be overly isolated in his home due to the COVID. Mental health professionals upset that employers are not providing or using PPEs, telehealth, and other requirements. Foster families giving termination for continuing to work during the pandemic, even though the client's job was part of an essential service, like stocking at a grocery store or doing something that's considered an essential service. There's just a detox facility kicked out all the clients because one client had COVID. And another client was found deceased in his apartment by an RN who was coming to do a COVID test. The client had been reported to be having cough symptoms. Client hospitalized for seizure concerns, but the support staff wasn't allowed to be at the hospital with the person who has the seizure disorder. We have lots of cases where a family member or a support person or guardian can't go in to a hospital when there's, because of the no visitation, except many of these clients can't communicate or don't fully understand what they need to communicate to get their own healthcare taken care of. 30-day notice given after a client residing in a nursing home was given that 30 days notice. The question came up as to whether that would be against the no eviction order signed by the governor. Another 30-day notice from a sober home. The client violated the stay-at-home order. Client states all violations were for MD appointments, and he had MD notes to prove that. Discharged from—
Yeah, a couple more, Ms. Opheim, and then we'll talk about it, okay?
Yeah, no, I can move on from there. I just wanted to give you some inkling about how this is going.
Can you comment, there's a lot of examples. Can you comment just for a minute or two about what you see as systemic, and talking to the commissioner, they're working on resolving a lot of this. So can you talk about where you see the real gaps, maybe even yet, in systems? And my grandkids are keeping us company here, so.
Yes, I've noticed. They're cute and they're distracting to me sometimes, but all with good delight. The major issues that we're hearing about are housing, kicking people out for very minor infractions, kicking people out for doing things that you and I have a right to do and should be able to do. And in some cases, older facilities that if you're going to quarantine someone legitimately because they have COVID or have been exposed to COVID, the rooms don't have television access, they don't have phone line access, and so they're quarantined in these rooms with little or nothing to do. One client is under commitment. I thought this was a little bit ingenious. One client who's under commitment feels that they should be discharged because governor ordered them to stay at home and the facility is not their home. So there are just so many of these issues. And ARC, I know, has put out some guidance about how to protect the rights of people with disabilities. DHS licensing worked with the Department of Health back in March to put out some documentation, but there's not really a central place where people who say, I'm not licensed by health, I'm licensed by DHS, where do I go to get information? Can I discharge people? Can I give them more medication? We're hearing that clients are being told they must stay in their rooms for this whole time and not come out. You know, so they're confused as to what should be going on. And this document that we're working on for 245D, I think, is going to start to address it, to say, you know, you can't tell people they can't go on walks or go for a ride or do the simple tasks that you and I do. Apparently one assisted living facility didn't want someone to come back because they had gone to the pharmacy to pick up their prescriptions. So, you know, the issue falls around whether or not eviction from a facility run by, licensed by DHS or under their rules, and whether or not they can evict people for things that they, you know, for either getting the disease through no fault of their own or and being made homeless. We've had people being made homeless. And so we'd like to know, does the no eviction order, is it applicable to people with disabilities? And if it's not, what are the recourse? Why is it okay to discharge people with disabilities when it's not okay to evict or discharge people from their homes who don't have disabilities?
Well, thank you. So that seems like a really interesting question, and it's actually going to come up on the nursing home side as well. And I think it came up already in a conversation earlier today with me.
Senator Abel.
Yeah, go ahead.
I just wanted to comment. We've been doing a little bit of research on that specific piece and came across that the federal rules on waivered services basically say, you know, services are both the kind of the services you get, but also the room and board portion when you're living in a facility. And that there has to be a written agreement between the provider and the client being served. And the waiver rules out of CMS say that those fall under landlord-tenant law and should be given the same weight as landlord-tenant law because you have a written agreement.
And that's what I would have thought. So, so the commissioners come prepared to talk about changes in executive orders, which I think, if I remember our conversation, Commissioner, you would rather wait to talk about those. Do you want to comment on this part at all? Or wait till your final segment? So I want to save 10 minutes for that.
Well, let me just say that we've been looking into the letter that Roberta wrote a few weeks ago and working with her to develop guidance for disability providers. We're looking particularly at this question of eviction. So far, our analysis shows that the executive order that was the non-eviction executive order was under a statute that related to landlords and doesn't seem to relate to the service providers for people with disabilities. I appreciate what you just said, Roberta, about CMS guidance. We can take a look at that as well. And so we are wondering if something other than the governor's non-eviction executive order also needs to be enacted to protect people from eviction from group homes and other services. At the same time, our demission rules haven't changed at all, and we want to go back and see what those say about demitting people from these services, to be sure that we actually need something more to reinforce our licensing rules for these services.
That's very good. I think it's a good comment. So let me turn to Mr. Griffin, who has come to speak on behalf of at least one slice of this, not the whole slice, and then we'll discuss this. And I appreciate everybody being here. Mr. Griffin, welcome to the conference call to Zoom.
Thank you, Mr. Chairman, members. My name is Phil Griffin with Ewald Consulting. I'm speaking today on behalf of ARM. ARM represents nearly 200 organizations that provide residential support to individuals with disabilities and mental health challenges. Along with the rest of the country, we are walking through this uncharted territory of the COVID-19 pandemic and taking each new challenge and obstacle that's presented on a day-by-day basis. Every day, providers are doing everything that they can to ensure that the people they support and the staff they employ are safe during this very unprecedented time. Our members have weekly communication with the Department of Human Services and the Department of Health and rely on the guidance that's being put out from those departments when making decisions. Providers have been told by the department to base their decisions on a case-by-case and individual-by-individual basis. With that in mind, we would be reluctant to comment on any of the specific examples Ms. Opheim outlined in her letter or in testimony today without the knowledge and background of what went into the individual decisions. Prior to the crisis, disability providers were already experiencing a historic staffing crisis with nearly 19,000 direct support professional job vacancies statewide. At the beginning of the crisis, we were not even on the radar as groups that were needed to access limited supplies of personal protection equipment. We are doing everything we can to come together as a community to make sure that our staff and those that they support have proper protections. This is an incredibly challenging time, and we hope that the Ombudsman's Office, the department, and others from within the disability community will work with providers during the COVID crisis to help ensure the safety of everyone within our community. The crisis is at our doors. At one of our residences, we have 16 individuals who have tested positive that are supported there. 5 of those individuals were hospitalized. 2 currently remain hospitalized. 1 is in the ICU, and 1 individual has tragically already passed away. We don't want to end up like Bob McGuire, the executive director of CP Nassau in New York City, who on April 17th was quoted in the New York Times as saying, "One day we were fine and then we were in trouble." Disability providers and the direct support professionals they employ to support individuals with disabilities are essential workers during this crisis. However, unlike the well-deserved attention that's being given to the medical profession, nursing home employees, and the service industries, our workforce has gone unnoticed and unacknowledged for the critical supports they are providing. We appreciate your committee's attention to these issues and look forward to working with you and the department and the Ombudsman to further solve problems. Thank you, Mr. Chairman, members.
Well, and thanks, Mr. Griffin. I think you said it pretty well. And in my take on this, I thought it was my responsibility to bring this up and talk about it. And I think it's a constructive discussion, and I see everybody facing forward trying to address the challenges. And you superimpose this whole COVID thing on an already very challenged industry, which is already short of staff and not real fat in the money. And so here we are. And so we'll be interested in keeping a handle on this. Senator Hoffman, did you raise your hand? No. Okay.
Mr. Chair, I guess I have a question for Mr. Griffith. I was on the phone this morning with some residential providers, and there's been an issue with, and I don't know if you're hearing that as well, but one provider, they're 90 days waiting for a service agreement on the residential side, and it's granted, they'll get the money in the rears of that, right? But the cash flow right now keeps it pretty hard. Are you hearing the same thing at all from any other providers, or is this just one that has just come up anecdotally with a few?
Mr. Griffin.
Mr. Chairman, Senator Hoffman, that's not something that ARM has heard of. I've just put in a question to our executive director to check on this, and she tells me that it's not something she's aware of, but let me please check and go back, and if you and I can talk further offline, I'd be happy to look at this. Certainly is concerning.
No, that's fine. Thank you, Mr. Chair, and thank you, Mr. Griffin. It looks like it was isolated to one county, and I'll touch base with you afterwards. Thank you.
So any other questions from members? I have a question of my own, but I'll yield to people that want to ask something. No, Ms. Opheim, what, so this eviction matter, it seems like this is a thorny thing to solve, and it goes from people wanting to protect their staff and the other clients and trying to do justice by the client they have, and being afraid. A lot of people are very afraid of all this, and it's it's a fearful time, and so you add that all together and you wind up with these circumstances that you related. Once they get the eviction question figured out and the right to stay and what that all means, are there questions about visitation and being able to smile through a window, and what other topics are going to be the harder ones to fix, do you think?
Chairman Abler and members of the committee, I do believe that there are a number of issues that are difficult, but the eviction seemed to be the most pressing, because where is the individual going to go if they lose their particular housing? The issues of visitation, I think most people they're concerned about it, but they're adapting well and understanding that it's not the same kind of visit that we would have had in the past, but that it's okay to have a social distance visit of some kind or other. And so I think that, I think those are easier to work out, but things that involve things that are in law, in rights right now, and whether they have to be waived or not, the discharges from residential programs is something that is in the waivered services rules, and it hasn't been waived. So they would still theoretically have to give 60 days notice and then have a transitional plan and a safe place to go. Number one, they're not saying you have 60 days to remediate this and you're going to be discharged. They're saying, no, you just can't come back in. In fact, we'll just shut the door on you and you can't come in. And that's not a safe discharge. So that's why we have to work on what's fair and not fair.
That really got my attention. That just seemed, that part didn't seem reasonable to me. So a couple more minutes on this, Senator Benson, please.
Thank you, Mr. Chair, and I'm glad Commissioner Harpsted is here. So as I'm listening, I know that there were provisions made for quarantining, isolating folks in homeless or at risk for homelessness. There were some hotel facilities that were arranged. Do we have the same coordination with these kinds of facilities? Because I can understand how clients and staff, if someone tests positive for COVID, wouldn't want anything to do with care in that circumstance out of fear, not out of compassion, but out of fear. And I know there'd been some provision made for people with step-down discharge out of nursing homes. And if we're gonna say you can't discharge someone without a plan, but we're also going to make them completely responsible for caring for someone with COVID, I think those two things create a clear conflict. So Commissioner, do you have any thoughts on that? And is there something we can do to help?
And so with that, I thought we would, when we finish this, I thought we were going to segue to the Commissioner for the balance of the time. So that's a really good segue. And so Commissioner, I'll look forward to your reply. Just to point out, in my judgment, your job is, as they say, trying to build an airplane while you fly it. And so, and that's, I think, that we're seeing evidence of all this challenge. So Commissioner Harpsted, it's minutes left. And so if you want to guide us through a discussion of however you want to react to what Senator Benson asked, and then fill up the balance of the time, and we'll dialogue perhaps if people want to ask you something along the way. So Commissioner, please.
Thank you, Chair Abler and members. If I could, a few background comments to suggest how far we've come in this COVID time in terms of services for people with disabilities, and then I can respond to specific questions. 5 weeks ago, the governor signed Executive Order 2012, allowing the Department of Human Services to flex rules and regulations to help Minnesota get through this peacetime emergency pandemic. 5 days later, we stood up the first 12 decisions under that order, focused first and foremost on maintaining public health coverage and other key supports like MFIP and general assistance, and supporting nursing facilities and childcare providers to support the healthcare sectors most critical to our COVID-19 response as a state. We also applied immediately for a broad range of federal waivers to support our decisions, and because we were one of the first states to apply, we received federal approval within a week of our first wave of decisions. Very early on, I also shared guidance for handling COVID outbreaks from our own direct care and treatment operations, especially our group home operations, with the ARM Association to share with their members, because I knew that we had these non-medical providers who would suddenly be handling medical issues. And our direct care and treatment group homes for people with disabilities have something more of a medical focus, given that they're part of an overall healthcare system. So we made sure that the ARM members all had the kind of guidance for COVID outbreaks that our own direct care and treatment operations had. We also posted MDH-approved guidelines for making fabric masks on our website, because as people went to stay at home, we heard that many of these providers could get their donors and supporters working as quickly as possible to supply masks in these residential settings. Shortly after, we went to stay-at-home orders, and we turned our attention to tele-everything, allowing a whole spectrum of medical and behavioral health, assessment, and case management services to be delivered remotely. So the Department of Human Services has been focused heretofore on health and safety, just as the Department of Health has. And it's just now that we've been able to turn our attention to more social and emotional supports for people with disabilities. A couple of weeks ago, we did make a decision to hold and pay for space in residential settings for people with disabilities who may become hospitalized, so that they have a place to move back to after their time in the hospital. Just the other day, we allowed group home providers and other housing providers to continue to provide services in other settings. Think about moving a group home resident or two to a local hotel in order to isolate and get the home through a COVID outbreak. Along the way, we've worked with Minnesota Housing to create an at-risk populations work group to raise the visibility on the governor and lieutenant governor's morning briefing of congregate residential settings like homeless shelters, ICFs, group homes, residential services for people with mental illness and substance use disorder, and also PCA and other services delivered in people's homes. The purpose of that visibility is the reminder to all that it's not just the acute care hospitals that need PPE, isolation protocols, and testing capacity. And we have particularly been focused on sheltering and isolating the homeless population and working to acquire masks for all staff and individuals supported in all of these settings across the state. This work has also led us to holding up for visibility the populations who might be at risk from a prolonged stay-at-home order, including families at risk of abuse, people at home diagnosed with mental illness and substance use disorder, and people with disabilities and older adults now living home alone or in families who used to go to now closed day centers. So just this morning, we gave preliminary approval to a decision to allow day center providers for people with disabilities and older adults to provide many of their services remotely to the individuals they normally support. We've also reviewed the letter, as I said before, from the Office of Ombudsman for Mental Health and Developmental Disabilities, chronicling the complaints she's received from individuals and their families. We've drafted guidance to providers to address the issues like overreaction to isolating and distancing guidelines. A draft has been reviewed by our rights preservation work group and now by the Office of the Ombudsman, and we're close to sending it to providers. While we feel we're moving at lightning speed over the last 5 weeks, flexing over 40 areas of rules and regulations in just a few weeks, I appreciate that it feels like forever to providers who are anxious about getting guidance to keep their services vital and people supported through the COVID pandemic. I would say some of the things that we're hearing in terms of the overreaction and fear of providers in the group home settings, COVID, and either discharging people or not letting them go outside or not letting them come back, is the response of these non-medical settings to this medical issue. And we've been working, as I said, to get guidance out to them about how to handle these medical issues and how to isolate people and get them through COVID if they have symptoms in these settings. And we've heard great examples of heroic efforts by people in these settings to go ahead and isolate and keep people in their group homes, sending them to the hospital only when they need to, and having them come back to recover. In terms of the shelters that Senator Benson mentioned, we know that many of the people in those shelters are also elderly and have disabilities or mental health issues. And so that's why we are so glad to be partnering with Minnesota Housing in a common effort to provide sheltering and isolation for the unsheltered homeless. We've had communities and counties come forward very generously offering hotel space so that we could help people find a place to be, a place to sleep, and a place to isolate to get through this period of time. We also expect people to go to those spaces as a step down after hospitalization to recover before they go back out into community. And so the Minnesota Housing Department and the Department of Human Services are working together like never before to work on protecting that population. We are also working closely with the Department of Administration. I just talked to them again before this call on procurement of supplies, PPE, facial fabric masks, and the things that these services need to serve their clients or the individuals that they support when there is a positive COVID case in one of these settings. The Department of Administration is moving as quickly as possible to order and distribute those kinds of supplies. You probably know those supply chains are very, very stressed right now, though we're expecting 40,000 fabric masks this week, and we have an order in for hundreds of thousands more going forward. And so I think the visibility of these non-medical, non-acute hospital settings has gone up about 300% in the last 3 or 4 weeks in state government. And I can tell you that a significant chunk of the procurement of supplies and PPE is being routed to these non-acute hospital settings as an acknowledgement that they too are dealing with these issues every day and they need some of the same supplies as the acute hospital settings. So we're continuing to work to move these settings to a place where they can handle these issues. And I would say that most of the providers are doing a fine job of taking care of the people in their settings, handling them even when they have symptoms or even when they test positive, sending them to the hospital when they need to, and having them come back to recover. And it's very unfortunate to hear some of the situations where people have had overreactions to the fears and concerns about this medical pandemic. And Roberta, from some of the stories you've told us about today, I suspect we have some license violations, not just some differences of opinion or the need for guidance, but potential serious violations of license in terms of people being turned out or not allowed back in. And so we will have to take a look at each of those and see where those go. I can stand for any other questions or comments that people have.
Well, I appreciate very much you coming, and actually compared to last time, we have a little bit of time. We have to race through, so that's the good news. And so I have a couple of questions, and if members do too. I just got there's just a chat here from Ms. Bang about guidance about how to address COVID positive caregivers and clients. And I don't know if you saw that on your chat, it's just sitting there, so I don't mind identifying her since she said to everyone. Is there a bunch of guidances you're still developing, Commissioner, so that people will know what to do? And it'd be interesting as you go home and evaluate this, and Ms. Opheim, if some of these concerns about these people locked in their room, people quarantined in a room with no TV, which I find to be personally horrifying and unacceptable. And to those people, we're watching, and so we're not okay with that sort of thing. But, and if those are early on when we're starting up, I can kind of get that people are really nervous, but now we have to figure out a way to help this go on for a period of a year or longer. This is gonna last, everybody knows. So is there a bunch of stuff in the works still, Commissioner?
In terms of guidance for handling these cases in these settings?
Well, I mean, all the things you've heard, you know, and so you're kind of sorting through a lot of these things. Ms. Vang just wrote, the PCA program has not received any DHS guidance on how to address COVID positive caregivers or clients. And so maybe there's guidance she hasn't read, or maybe you didn't even know to write it. You've been pretty busy. So I don't know if you're familiar with that point. That's a detail you maybe wouldn't even know.
Yeah, well, I mentioned some of the things that we've been discussing. We have a PCA decision coming to us next week to take a look at what particular things we need to do in that space.
Yeah.
And so we'll take a look at that. I'm also meeting tonight with a whole association of PCA providers, mostly to listen to see what their concerns are and what other things they need from us. It sounds like we need to keep issuing our guidance over and over and making sure we make it available in places where people can see it, because we've had guidance out for weeks on how to handle these cases in these congregate settings, but we continue to get a lot of questions. So we need to find better venues and ways to continue to communicate and communicate and communicate.
Yeah, and so I mean, just that's a quite a case in point, and Ms. Vang seems like a relatively, quite an informed provider, not, more than I know for sure. And so if she doesn't know, I wonder who else doesn't know. And your predecessors, I've had a lot of chats in the past about, you put it in a bulletin. Oh, it's in a bulletin, like a bulletin 9 of 400. And so how could you possibly have missed it? And so maybe your thought that maybe you want to have a synopsis of general guidances that you put together might be a good idea.
On the front page of our website.
Okay, very good. So anyways, I don't know the answer to the question. And there was one other, Elise was here, but in terms of all the flexibilities, Ms. Calvert was unable to apparently get paid for doing some of their visual performing arts with Interact off-site. And I thought there was some accommodation to that. So just in your to-do list between Elise and whoever else, if you can just kind of look into that. I think that's exactly what you're trying to accommodate. But some of these places that don't know about the accommodations either are going to be struggling to even know that that is now that they can get compensated and keep them open. So I really commend you, Commissioner, for you and your staff for, if some of the old commissioners, if they would have, the former ones, if they would have seen the speed that you're running at, they would think this is, like the Indy 500 or something for what they've been accustomed to, where they take a year to decide things. So.
Well, it is surreal to have taken and made flexibility to 40 different rules and regulations in the last 5 weeks, which we usually spend all of our time trying to meet. So it's been really an unusual time. But we've also learned that we can't communicate enough. And despite all the communication that has happened, we also continue to hear from some communities of color and other people that they're not getting the information. So we're just going to continue to find better and better ways to get things out. We heard last week that there was a lot of concern about people not understanding the availability of mental health resources. So we put up a new page actually in the governor's office internet site about all the mental health resources available to people, and people were delighted and surprised to see what was available. So we just can't communicate enough and in enough venues for people to understand what's possible. But there are some areas that I've heard today that we have not yet issued guidance in. We haven't issued specific guidance to PCAs or PCA organizations about how they should do their work. We have some PCAs that are continuing to go into homes and many clients that are welcoming their PCAs into their homes. We have other situations where either the PCA is nervous about going into the home or the client's not allowing them in, and everybody's kind of using their own personal judgment in these COVID days. We also know that there are people isolated in nursing homes and even in acute care hospitals without family and without television, without iPads and all kinds of things. And so we're doing the best we can, but it's certainly a time that we're all adjusting to and making judgments about every day.
Senator Kiffmeyer.
Thank you, Mr. Chair. Thank you, Commissioner. I know the overwhelming circumstances here. I can see it in your face and voice, and appreciate all the work you put in. One of the things, Mr. Chairman, that I think as far as communication is concerned, we have associations of PCAs. We have ARC. We have Lutheran Social Services. We have all kinds of these associations that are specific. DHS covers a huge breadth of issues to deal with, whereas some of these associations have a very more narrow kind of a thing. And I really think that some communication here, coordination with DHS to these associations, but I think the associations have some responsibilities. Many of them have dues or have staff, and they should be augmenting this communication. And maybe Mr. Griffin from ARC and some of these other ones, what are they doing to help their specific constituency to take what they get from DHS and push it on down the line as well?
Well, Senator Kiffmeyer, I don't know, but I know how to find out. Mr. Griffin, what do you want to say about that?
Thank you, Mr. Chairman. Senator Kiffmeyer, we are working with our membership to try and keep them informed on a regular basis. We meet weekly with the department. We have our website up and we do calls with our membership on a weekly basis to make sure that they know what's going on. And I have to congratulate the department, the commissioner and her staff for working closely with us and making those calls on a weekly basis work so that we can get questions directly to the department and answers directly back to our membership.
Senator Kiffmeyer.
Yeah, that's great to hear. Is any other association there and that wants to chime in as to what they're doing?
Anybody here?
PCAs or?
I think they all left. Anyway, so, well, I mean, they kind of testified and moved on, so.
Sure. Mr. Chair, that's all I have. And
okay, thanks. And so maybe I'll make an announcement. There are a couple of points. If you're not sure, check the website. And sometimes it's, if people really don't know the answer to who to get a hold of at DHS, send an email to me and I'll forward it off to Mr. Burdick, who solves every problem that's ever been known. And at least that way that sometimes the electronic ether eats up some of these contacts and the wrong person gets contacted there. So if you just are stuck, I'm a good choice and we'll make sure it gets sent right off. But there's always something that we could say could be better. But look at where that we have come in this short amount of time. I don't recall what day it was we passed out Senate File 4200, but it hasn't been much more than 3 weeks, I think, or
5.
Is that right?
Mm-hmm.
And it hasn't been 4, it seems like a century.
Mm-hmm.
And so, and I still wish we could put that thing into statute so we can keep the governor kosher on his authority. Christmas, maybe. But anyway, but this was the last formal committee action that we did in live census. And even then we were distanced pretty well. And so I'm really kind of proud of us as a committee that we can work in a bipartisan way to address all this. And so many committees just hear all this sniping back and forth, and I don't think that happens very much here at all. And I'm really kind of proud to be a part of that with all these amazing colleagues of mine and all the groups and the entities. And Minnesota does care about the people with disabilities and special challenges and all that. And we think the highest of them. And so, Commissioner, I appreciate you leading the department of all the things you have to handle and the things that are on our mind. We'll meet next week. Part of the content will be looking at some more of these identified accommodations, and we'll see what the topic will be. But just plan on next Wednesday at 3. And
so, Mr.
with
Chairman,
that, I wish you all. Yeah, Senator Kiffmeyer.
I just wanted to say that as a nurse, and I know you as a medical professional, one of the things we find when our folks are overwhelmed, and which right now the general public out there is incredibly stressed and overwhelmed, it's really hard for them to sort out information. It's just overwhelming for them. So yeah, they may not think of the website, they may not think of a variety of things. I just think compassion for our regular Minnesotans, but especially those with disabilities are going through right now. Very stressful for them, and it's really hard for them to sort this all out. And it doesn't mean there aren't efforts by DHS and other people. Part of it is we're not speaking into a normal life situation for people.
Mm-hmm.
Thank you, Mr. Chair.
Okay, yeah, I think that I think we'll call it a day at that. This has been, I think, a very productive meeting. And so we'll continue this discussion next week. Pray God's protection on all of you and the people you touch, or actually don't touch anymore. And with that, we're adjourned. Thank you very much.